Hi, it's Dr. Ross Carter with the Medical Influencers Show. Today, my special guest is Patricia Boulogne. Welcome to the show today.
Thank you very much. I'm very happy to be here.
It's my pleasure to have you. So, Patricia, you have written a book about not being sick and tired. Isn't that correct?
No, it's called Why Are You Sick, Fat, and Tired?
Right.
And the goal of the book is so people can find their weakest and strongest links.
Mm-hmm.
And they can do that through a process that you go through in the book in order to go from having no knowledge and coming out with knowing what to do with your health care and what your next best step is.
Perfect. So if someone, how would someone know if this book was good for them specifically?
Actually, I believe, since it's my belief system, that when you have health, you have 1,000 dreams, and when you don't, you only have one. So a lot of times people don't pay attention to their health until they're in crisis. And when they're in crisis, then, they're scrambling to find answers, and they're grasping at anything that comes along, as opposed to knowing where to start. Where's the weakest link? Mm-hmm. So this book is for anybody. I wrote it so that an 11-year-old kid could take it and understand what the questions were and be able to answer them. So anybody who's breathing basically can take this test. It's like it's for women, it's for men, it's for anybody who wants to know where their health is right now, this day, this time. And then it also acts as a tool so you can take that information to your healthcare provider or a qualified person who's a functional medicine or lifestyle medicine physician. Now,
the test is in the book. Is it online as well so that they can take the test online, or is it only in the book?
Right now it's only in the book, but we're developing an app so that people can do that test online also. Mm-hmm. But right now there's an introduction, there's a very methodical way and easy format to follow in order to get to the point where you're taking those questions. And the questions are sorted out by organ system. So there's 11 organ systems that are taken a look at, and 11 for men, 11 for women. And the idea of it is that these organ systems are controlled and coordinated functional-wise by the brain, right, and the nervous system. Yeah. And so each organ system has some level of interrelationship with another organ system. So like if the gut's off, then the liver's going to be off. And the liver's off, then the heart, the cardiovascular system is going to be off, and so on and so forth. So it's the trickling effect.
Excellent. And so it goes through 11 different systems. Now,
yes.
How is it different for if a man takes the test as opposed to a woman? How does it change?
Well, there's only one section for men, and there's 6 for women. And so when it looks at women from being, we're complicated. I guess. It looks at women being, from, premenstrual, menstrual, and postmenstrual. So there's questions specifically designed that address those times in your life.
Mm-hmm. Got it. And men are just always the same, no matter what.
Well, they're not always the same, but it's like you ask them, you ask men, how are you doing? You're a physician, so how are you doing? And they're fine. The only time that they're not fine is when they're throwing up in the toilet, which is a different kind of sick. And so they are always, they're just, they're geared, or their mindset is always to be in tip-top shape, because that's being a man.
Sure. So what specifically benefits when they take this test? How can you benefit from that, just having this test? What are the benefits?
Well, one of the things is that a lot of times, one of my mentors and as a physician, his name was Victor Frank, always said because he was like a cowboy, like he was like from Southwest, the United States. And he always said, what you got isn't necessarily what you got. So a lot of times people will ask their friends, or else they'll do a search online, and then the information overwhelms them. This condenses and funnels the information in a particular fashion so that they have the answers that they need, so they don't get overwhelmed. because knowledge is power, and it's very powerful only when it has the ability to be able to stack that knowledge in a next step type process. So the questions are asked. You can see there's in the book there is a chart, and I also made a link, so there's a downloadable version for that. Because this is way too small, or if someone doesn't get that with their book, please reach out to me. I'll send it to you. But there's a way that when you look at it, and what I have people do is I have them color that chart out. So it starts like with the gut, and it goes to the detox, and it goes to endocrine, it goes to brain, and the neurological, musculoskeletal, men, women, etc. And so when someone actually writes their scores, because this questions that you're answering in present time or within the last 3 to 4 months.
Okay.
And so when you chart that out, you can see a pattern. So, and when I see that pattern, when I'm analyzing that, I'm thinking, okay, so what, based upon what someone tells me and what I see on the chart, I'm thinking, read in between the lines, what's really going on here?
Right.
Because we always have our friends who say, like, I've got stomach pain after I ate this. Like, oh, you're probably allergic to it. Don't eat it again.
Right.
When that could be creating more things like with irritable bowel and other, bowel type syndromes or leaky gut, that people aren't addressing that. For me, and for people who I know, they would really want to know what's going on before it becomes a crisis and address it in a simplified fashion, which is a lot. For time, energy, and money, it's a lot less expensive to do that than waiting until you have a huge crisis and you're working on it for months as opposed to just a couple weeks.
Now, did you utilize something like a version of this test in your practice yourself? Or how did? Okay.
I did. That's exactly how, when I first had this, I used to give this out all the time, and I had, and the supplementation or targeted supplementation I chose to use after diet and exercise, targeted supplementation. Then I would, and if that wasn't getting any place, then I would send them and in joint effort with their, physician. And then, but how I designed it was so that, that people, when they had results, I noted the results, I noted what products worked better with those people. And I, used more of those products with that in that given time. So there's a lot of people, for instance, that always asking me, can I do a detox? And my answer to them is like, well, it depends upon what your gut's doing.
Right.
Because the liver only does the function of detox. You don't ever detox the liver. And so when you have an issue with the gut, then if the liver's detoxing, it's dumping all those toxins back into the gut, and then they're getting recycled again. And if they're getting recycled again, when the liver becomes overwhelmed, then they get stored in blood, brain, bone, and fat. And so, there's a lot of issues and a lot of chronic illness and diseases that relate to those 3 places in the body.
Wow. And so did you come up with this test, or how did the test come about? How did you figure this out?
Well, what I did is I had like 3 of them in my office. And what I did is I looked at, which questions were the same. And and then I funneled them down into like one part of the test. And then when I would give it to people would answer, if they missed answers, I would like, why did you answer this? Because it always took like another 10 minutes. As opposed to just being able to, make sure that it was all, you could just talk about the pattern as opposed to going back and explaining what the questions were. So I decided one day that, I'm going to make this test so anybody could take it. And so I reworded the questions so that they were my own, and that they, and they said the same thing, but they said it in like an 11-year-old could understand it. And how I know that that's true is because I had an editor who was 11 years old, and he went through and highlighted any words that he didn't know. Right. And then then we figured out what word would be the best word for that. And of course he got paid. But it was really interesting to see, because we as physicians, we think we're talking English, and people looking at us, and it sounds to them like wah, 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 wah.
Right.
And then you're going back and you're starting all over again.
Mm-hmm.
And I always practice with my patients that they could interrupt me anytime, anywhere in a conversation if they were not understanding what I was asking them or what we were talking about.
Right.
You know,
Yeah.
So I always thought that was a good practice.
I love that. That's awesome. So you've incorporated all that into a book that people can just do it for themselves.
Yes, and it's like it's a DIY. You can advocate for yourself. So when you go into a doctor's office, so many people go in and they're saying like, I don't feel good. And so medical doctors, generally speaking, traditionally, and even, functional medicine wise, they're going to ask, the functional medicine doctor will ask more questions about personalized medicine and about the lifestyle. Western medicine will have a tendency, let's take these battery of tests.
Mm-hmm.
And so some of the tests that they give, aren't necessarily conclusive of, long term. So like when you're looking at like thyroid, a lot of physicians will just do the TSH test for the thyroid and not do the full panel. Right. So you're not getting all the information that you need to make an educated decision about how to move forward with that particular person. And you're not taking that as in relationship to the rest of the body.
That makes sense. And it's really good to be informed before you go see a doctor, because he's got, he doesn't have limited time to see a patient, right? And going in there with this is what I need to have addressed, and here it is, it makes it a lot quicker.
It does. I've been in physicians' offices before where I've gone to see a doctor and, it's just like cut it to the chase, as they're only paid by we only have a certain slot of minutes. So if your story is too long and not concise, then they cut you off. They stop listening when they're looking at the clock and they only got one more minute. And so this is a good way to be able to come in and present, hey, I've got this X, Y, and Z thing going on. How come we're not addressing it? Or don't you think we should look at this? Mm-hmm. And if their doctor has any questions, this doctor can always reach out to me. I'm more than happy to have a conversation with them.
Perfect. So this book really addresses nothing specific. It goes after really every organ system of the body overall for men and women. Is that accurate, or is there a focus?
There's a little story behind that too. Two people who gave me an endorsement both called me up and said, Pat, there's a bunch of questions. And I said, you always got to know where to start. When crap hits the fan, I've heard so many functional medicine doctors that are well written say, when crap hits the fan, you got to go back to basics. This automatically, anytime I ever start with somebody in coaching or working with them, even as a chiropractor, when I was in active practice, I would always start with basics. I'd go back and see, well, what's going on with the foundation? Structures function. Health never goes out of style. What else is going on here? And putting the pieces of the puzzle together. This puts the pieces of the puzzle together for somebody so they can understand in the English language this is what I got going on. I know where exactly I have to take care of that. And I know where to go for it.
Right. And is like I was saying, but with specific conditions, is it more of a broad stroke kind of idea, like this is an area problem, or is it more specific to specific issues, or I don't, because I haven't seen the test. So how specific does it go?
It goes specific for the organ system, but somebody who gave me a recommendation for the book and on Amazon said, called me up and said, well, what can you do for myofibrosis? And I said, you didn't read the book. And they said, called me back up. What can you do for, I have stomach pain and I have chronic fatigue. What can you do for that? Same person. And I said, you didn't read the book. So after she read the book, and I thought she just left, and she didn't come back. When I was so surprised when she sent me a copy of her review, she said, oh my God, what an earth-shattering awakening. I've never had a doctor ask me those kind of questions before about those organ systems. And I'm clear the reason why I have myofibrosis and the other things that are going on with me is because I have inflammation in my body. I've got to get it out. So it targets with those organs that are the weakest link for that, which have the highest numbers. And she related it to an interesting analogy. She related it to having a flat tire. When you have a tire that's low on air, you have a tendency to go in the gas station, put air in it, and then you go to the tire place, and you have them put air in it. And then, one day you're driving down the road and it's flat. Well, Western medicine usually does not, they're not able to diagnose a problem until you have a flat tire. And by that time, you're in major crisis. And so this way, it's a preventative, like, hey, I've got this going on, what can I do to up my game for my gut? Or what can I do to up my game for my central nervous system or my immunity? Chapter 7 is about immunity, and with the thing with COVID virus going around, it'd be a good thing to know if I have a low, moderate, or high priority problem going on with my immunity. Hopefully, it's none at all.
Right.
And I've had people who have taken the test very quickly, and then when I talked to them and looking at what their scores were, we discovered they were in an airport waiting for their plane, and they really didn't read the questions very well. So I really behoove people to take, some quiet time, take some tea or whatever, and just, go into the book and, go through the questionnaire, plot out your graph, and then, connect with me or someone else who can help them really go from point A to point C in the most expeditious manner, in the most less invasive way also.
Beautiful. What was can you hold up the book? Can you show what a picture was?
Oh yeah, sure. Absolutely. Can you see it? Is it perfect?
It is. Well, now you have to speak. No, otherwise the camera's on me.
Oh, I'm sorry. It's called Why Are You Sick, Fat, and Tired? Find out now and find out your weakest and strongest links. And this is what it looks like. Why Are You Sick, Fat, and Tired? It's on Amazon, Barnes & Noble, and other, venues on the websites, or the internet.
Beautiful. So how long does it take most people to do the test?
I would say it takes anywhere from, I've had people tell me it took them an hour and a half to taking, where they're reading the book from cover to cover, to 3 hours. So, surely someone's health is worth like a minimum of 3 hours, right? So,
depends on the person. I would hope so, but
Right. Well, I'm always surprised when I ask people, if you knew what to do to be healthy, would you do it? And they hesitate. Right. And I'm thinking, that's like, you're hesitating, and it's just that because people don't want to be inconvenienced, and they think they need to be inconvenienced with lifestyle changes. There's easy way to do lifestyle changes and not make it a nightmare.
That makes sense. That's It's like, how much do I have to do? I'm with you.
Right. Yeah.
Perfect. Well, I think we covered a whole lot of great stuff. I'm very excited about your book, and I think this should be really helpful for many people who just, they don't know where to start when they have a health problem, to at least define it a little bit better, so that when they do see somebody about it, they can explain it a little bit faster and easier, and maybe get a better. It can help with diagnosis as well as treatment.
Well, the other thing that it helps people with is it helps them ask the right questions. Mm-hmm. Because if you don't ask the right question, you're not going to get the right answer. And if you don't get the right answer, you're basing those decisions in what you're going to do next off wrong information.
Exactly.
That's huge.
It's a big deal. It's a big deal. Well, beautiful. I think we've covered everything here. So I appreciate everything for your time today. And I look forward to taking a look at your book myself. And I really thank you so much for being on the show today, Patricia.
Thank you. Thank you very much. I appreciate it.
All right. Take care.